So we have three posters that we're presenting today, not today, actually this week. One looks at actually the adhesion effect of sickled cells with and without our drug, and what we focus on is the adhesion of the red cell primarily, and what we were able to show is that our drug significantly reduces the number of adherent cells to the endothelium, which we believe is an important part in the genesis of the vaso-occlusive event. We have another poster that looks at hemolysis. So I think we all have to remember that sickle cell, it's an anemia. It is a hemolytic anemia. I think sometimes that's forgotten because most of the therapies we have today are trying to prevent sickling and trying to prevent adhesion, but hemolysis is still a hugely important factor in the genesis of vaso-occlusive crisis and the overall pathology of the disease. And so our poster looks at does our compound inhibit hemolysis? And so what we showed is that when you add our compound, vepoloxamer, to sickle cells and then flow them under conditions that would resemble the circulation, we showed a statistically significant reduction in hemolysis. So we think that's really an important finding. So there's two more papers. There's a paper that looks at the expression of phosphatidylserine. So that is a component of the membrane that is always on the inner leaflet. And so when cells are damaged, there's an enzyme. It's actually called a flopase or a flipase. I get that confused sometimes. But the enzyme, it actually takes this phospholipid and it takes it from the inner membrane leaflet and it sort of flops it to the outer membrane. And when that is present on the outer membrane leaflet, it actually acts to stimulate blood coagulation, and it also is a signal that the cell is dying. So now this is all part of what happens when the cascade that causes these red cells to be cleared. So the half-life of a sickle red blood cell is 12 days in the circulation. A normal red blood cell lasts in the circulation for 120 days. So and part of it probably is this, once these cells sickle and the phosphatidylserine gets exposed on the outer leaflet, that's the signal for it to now get cleared from the circulation. So, and that's a big part of the anemia, and which is I think a big part of the quality of life of sickle cell patients. You talk to sickle cell patients, and one of the things they say, they're always tired, they're always fatigued, and that's a big part of the quality of life. So if you have a way to treat these membranes such that they can survive in the circulation longer, that I think would be an important benefit for them. So that we have that observation that when you treat red blood cells with our compound, you don't get this, well, I shouldn't say you don't get expression of it, but it's greatly reduced. So the expression of this phosphatidylserine on the surface of the red cell is greatly reduced. So that, we think that's another significant finding. And then lastly, it has probably less to do with sickle cell disease research, but we're looking at our compound because it is cytoprotective. So we're looking at its ability to preserve blood platelets during storage. So that probably has a little to do with sickle cell disease research, though. So.